views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗥𝗲𝗹𝗆 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗹𝗆. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗹𝗆 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗹𝗆 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗹𝗆 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Indeed, everybody, welcome to Healthline with 𝗥𝗲𝗹𝗆. It's January 8th. This is the second show of the year 2024. Welcome. Today, we're going to talk about viral hepatitis. And with us, we have Dr. 𝗛𝗲𝗶𝗶𝗵𝗹𝗆. He's a gastroenterology specialist and also a hepatology specialist. And, well, how are you, doctor? How are you doing today?
Hi, Nicole. Good afternoon. And good afternoon to all of the listeners and the viewers of your show.
Thank you, doctor. Good afternoon also, and thank you for joining us. I will ask you today to be very patient with me because I have so many questions for you. And as we say in the show, you've got questions, we've got answers. I actually have so many questions for you and would like to go through it one by one. Please be patient if I may be a bit repetitive because that's how people like me learn from experts like you. Okay, and then doctor, we already got a comment about you and I just have to tell you the comment was, ang pogi naman ng doctor mo na guest mo ngayon. So, I just have to tell you that. So, thank you. So, thank you for, doctor, I just wanted you to hear that compliment and I hope that person can send other questions also. Okay, thank you, doc. So we're talking about viral hepatitis. Can I ask you first, are you the person, since you're a gastroenterologist, and that would mean like the abdominal area and the digestive system and all that, and then hepatologist, so the liver, are you the specialist who treats hepatitis? Like, are you the lead person when someone has hepatitis?
Yes, definitely. Hepatologist is actually a subspecialty of gastroenterology. The liver kasi is a gastrointestinal organ as well. No, it's a special gastrointestinal organ. So hepatology is actually another subspecialty of hepatologist specialty of gastroenterology.
Okay. Thank you, doctor. So there, folks, you heard it. So if you have any questions about hepatitis, send them in now while we're live. And I will begin by asking you, doctor, what exactly is viral hepatitis?
All right. So viral hepatitis is an infection of the liver, no, that is caused by a virus, no. So there are many types of viruses that may infect the liver, no? But the common ones are usually viral hepatitis A, B, and C, no? And the most common, actually, which is endemic to the Philippines, is actually hepatitis B, no?
Hepatitis B. Okay, doctor, can we discuss hepatitis A, B, and C one by one? Like hepatitis A, for example, how do you contract it?
Okay. So these are what you call your modes of transmission. No? Hepatitis A, for example, is transmitted via food. No, food it's orally ingested. No, so the technical term is a fecal to oral route. No, so a person who is infected with hepatitis A, no, when he sheds his the stools, no. Hepatitis A virus is present in the stool, and through, for example, food handling, no,
yes. You have to be careful about
incorrect.
Yeah,
correct. So incorrect food handling, no, sanitation, no. So it deals particularly with that particular issue, no. sanitation and food handling.
Yeah, we have to make sure that we wash our hands really well, or whoever's preparing the food. So it's a bit like, it could be anywhere where you eat if they're not very careful with their kitchen and how they prepare the food. So that's how you ingest it. I'll just clear it up for the others. Fecal to oral route. It's a bit graphic, but really it means if somebody has hepatitis A and their stool or their poo-poo, kind of makes its way to the food, you get it by eating that. And it could be a very small piece, right, doctor? I mean, you wouldn't know with the smell of the food that, there's maybe garlic or whatever, but yeah, that's what happens. You don't handle food properly. I think there are also other diseases that you can get that way. And you're like, ew, gross, but it happens, right? Okay, doctor, okay, so how about hepatitis B? How do you what does hepatitis A do to the body? Like, how does it damage our body? Like, if you contract hepatitis A, what happens?
Okay, so in general, the viral hepatitis, viral hepatitis in general, all of these viruses can cause severe liver inflammation and destruction of your liver cells. So that's in general. So there are varying degrees. Hepatitis A, for example, can cause very acute flares, and this can be manifested by very high liver transaminase levels. So these are the blood tests that are pertaining to your liver, such as your SGPT and your SGOT, or your ALT and AST. And yes, and then one may also have jaundice, or yellowing, So you may have yellow eyes and yellow skin.
Okay, yellow eyes. How about red eyes? Just kidding. Okay. So that's what can happen. Basically, as you said, in general, all these types of hepatitis can damage your liver cells, and hepatitis A can do that. And we know how we contract it. How about hepatitis B? How do you contract hepatitis B?
Hepatitis B, I'll put them together. Hepatitis B and C are viruses that you can contract via blood and body fluids. So unlike hepatitis A, where you can contract it easily, from food handling, hepatitis B, you have to be exposed to another person's blood, or body fluids such as sexual contact. So, for example, those who handle needles, those who do injection drug use, because of their habit, injection drug users usually share needles, So that's one way of passing on the virus, from one person to the other. Blood transfusion, blood that is not screened properly, although that shouldn't happen nowadays anymore. Blood transfusion related infections have greatly been decreased, but it can still happen. So that's another way. And so there, and sexual contact.
Thank you, doctor. So for hepatitis B and C, you contract it the same way. It's either through bodily fluids like sexual contact, or you're exposed to the blood of a person who is infected with hepatitis B or C.
Yeah.
And
I'd like to add,
sure.
For example, razors, sharing of toothbrush, getting your manicure or pedicure, nippers, nail cutters, because there's a potential for injury,
Yes.
And a person who has hepatitis B, if it's used on another person and they get injured as well, they have a break in the skin, you can pass on the virus.
Thank you, doctor.
But you don't get it through saliva, okay? So
not saliva.
Body fluid that you don't get it from.
Okay, the only body fluid you don't get it from is saliva. But thank you, doctor. That's so thorough. So we also have to think of it's so easy actually to get it. I mean, let's say hepatitis B, yes, if you get a manicure, even if you cut your own nails at home and you happen to have hepatitis B, or maybe you don't even know you have it, and then you don't sanitize it, before or after, and then you're digging into your ingrown, and then crack, there's a wound there that happens. And also, like, I have seen, like, especially in the 80s, there was a big scare, not a scare or something about, there was some kind of campaign about hepatitis in the late 80s, and I was just a kid, but I remember hearing all about it. Like, it was like getting more prevalent. So, this topic is interesting for me because, wow, I haven't talked about hepatitis in a long time. And so you can get it that way if you're not clean, like with your manicures. You said you have to be careful. Blades. So anything that cuts or breaks the skin, and then the virus can get in. And sharing of toothbrush. Okay.
Yeah.
Okay, so, you better make sure.
I guess nobody shares their toothbrush.
Well, I've heard of people who do it, and I'm like, ew. So that's why I always hide my toothbrush when I'm traveling. Sorry, guys, but yeah. I mean, you better make sure whoever you're living with isn't just using your toothbrush without your permission. Okay, thank you, doctor. And also, of course, through sexual contact and bodily fluids, except for saliva. So you can kiss someone with hepatitis B or C and not eat it. But you can't, but if you have sexual contact, is there a way, like, what if, is it just, for example, okay, when you say sexual contact, is it just male to female? Is it male to male, female to female? Can you also get it that way? If it's not saliva, as you said, so you can't, okay, how about if somebody performs cunnilingus on someone? Can you get it that way from the fluid in the vagina?
Yes, you can. No, if you have like breaks in your oral mucosa. No, for example, if you have like a sore, or if you have like gums that are injured. No, then if you perform like oral sex, no, you may be able to contract the virus. No, as it penetrates the mucosa of your oral cavity.
And then if you okay, and then of course with let's say it's male to male, or so oral sex both for males and females. If it's male to male and there's penetration of the anus, or male penetration of the vagina, if I guess the semen or the vaginal fluids can transmit. Okay, there's nothing
can carry the virus.
Okay, and it's possible to get it, and that's probably one of the most common ways. Okay, can you prevent it by using a condom?
Just like any other sexually transmitted disease, it can be prevented. No. The transmission by using, like methods that would obviously be a barrier, no, like a condom, no. Of course, that would help, but probably also a good way to prevent it, no, since you probably couldn't tell where you would get it, no, is to just get yourself vaccinated.
Okay, yes, let's go to that, doctor, and circle back to the other ways on how we can prevent that. Okay, so we just discussed, what hepatitis A, B, and C, like how you contract it. Can you, you already told us that, all of these types of hepatitis can do damage to the body, the liver in particular. Can you tell us, doctor, first of all, how do you diagnose the respective hepatitis? How do you diagnose hepatitis A, B, and C respectively? Like when someone comes to you, how can you tell if it's hepatitis A, B, or C?
All right. So in terms of diagnosis, no, usually as doctors, unless the person has like frank jaundice, no, where you're very yellow, then we probably won't suspect that person to have hepatitis, no. Sometimes, no, they would come to us, no, with slightly elevated liver enzymes, no, your SGPT or SGOT may be slightly elevated, no. And then after which we would request further tests, no, further blood tests that are specific to which viral hepatitis, no, either A, B, or C. So there are specific blood tests that we can request, which will check for number one, if a person has infection, and then number two, if a person has immunity against that virus.
Okay. So doctor, so basically, if somebody comes to you, you suspect they have hepatitis, and they tell you, no, what are the symptoms of hepatitis A, B, and C?
All right. So hepatitis A, no, is a acute infection. So usually when one acquires hepatitis A, you will get over it, no, and it usually presents with symptoms, no. You can turn yellow, jaundice, no. That's probably one of the most common. You would have some fatigue, some flu-like symptoms, no, since it's a virus. So it's similar to like getting a flu, which is also a virus. You have fatigue, some right upper quadrant pain, no, some pain, some discomfort in the liver area.
Is that like
in the right
rib cage?
Yes, underneath the right rib cage is where your liver is located. No, so sometimes you can have some dull ache over there, no, which is very non-specific as well. So that's hepatitis A. No, hepatitis A is acute and usually presents with symptoms. No, and then after that, no, as a person gets over it, the hepatitis it goes away. No, there's no more hepatitis A.
Okay.
Hepatitis B and C, on the other hand, can become chronic infections, meaning one can have the infection for more than that hasn't had an infection for more than 6 months. So if you're tested now and then you're tested after 6 months and you're still positive for hepatitis B and C, it means you have a chronic infection. And it's usually those patients that do not really have a lot of symptoms. No, they're just walking around amongst us. No. And mind you, there's a lot of them, and they don't have symptoms. They don't feel anything. No, so unless you get yourself tested and checked.
Okay, doctor, have you ever seen? Just out of curiosity, have you ever seen a patient that has all three hepatitis, like A, B, and C? Curiosity.
Not yet.
Not
yet. And I probably wouldn't want to see that kind of patient.
Yeah, that would probably be
that would probably a very difficult type of patient. No?
Yes,
treating 3 infections all at once.
Okay. Doctor, how common is hepatitis? Whether it's hepatitis A, B, and C. I mean, is there a demographic of the population that you see getting hepatitis A, and then one getting hepatitis B, one getting hepatitis C?
In terms of hepatitis A, no, it's a sporadic type of infection, no. So it really depends on on what the sanitation status is from at the present condition, no. Plus, it's self-limiting, so it goes away. What's very interesting actually, and what's actually more important, is hepatitis B. 1 in 7 Filipinos have hepatitis are estimated to have hepatitis B.
1 in 7. Wow. Okay.
Yes. 1 in 7 Filipinos are estimated to have hepatitis B, and the prevalence reaches up to around 17%. No, so if you have like 100 million Filipinos, then there's estimated 17 million Filipinos who would have hepatitis B,
and they're around not. Some of them not even knowing that they have it.
Yes. So there is a great majority who do not even know they have symptoms. They do not even have infection.
So, doctor,
because they do not have symptoms.
Yes, they do not have symptoms. How about for hepatitis? Sorry, go ahead, doctor.
Hepatitis C. Yeah, for hepatitis C, the Philippines, no, is estimated to be at this pretty much the same level as the average worldwide prevalence of around a little less than 1%, no, of the population. No, so not very much hepatitis C, but it's still present out there. No, I think we don't have very solid epidemiological data, no, in terms of the number of those who have hepatitis C, but based on anecdotal researches, the prevalence is pegged at a little under 1%.
Yeah, I knew someone who had hepatitis C. He passed away some time ago, but it wasn't because of hepatitis C. But I mean, that was like, wow, like when he had to deal with it, it was very sort of unusual. I mean, it was considered unusual at the time, or maybe they just, they hadn't tested enough people. So I understand when you say it's kind of anecdotal and it's estimated at the same rate as the rest of the world. You're talking about hepatitis A, like it's acute, so it happens. You can probably feel the pain and the symptoms, but it goes away. Can it recur? Can it come back?
Hepatitis C?
Hepatitis A.
Hepatitis A, you develop immunity towards hepatitis A.
So you can't get it again?
No, you cannot get it again.
So once you're healed or cured from it, and we'll talk a bit more.
You develop antibodies against the virus.
Okay. So, and how about hepatitis B? You said, it can be chronic, like 6 months you have to treat it, but let's say you're able to treat it, and we'll talk about the treatment later. Can it come back, or do you always have it?
Usually those who have hepatitis B or infected with hepatitis B and become chronic carriers, carry the infection throughout life, no? There hasn't been medications that have been developed to completely eliminate the virus from the body, similar to HIV.
Yes. How about hepatitis C?
Okay, hepatitis C, no, we've seen a great number of drugs that have come out, no, within the last 5 to 10 years, no, and now we're fortunate enough, no, to have oral medications that can eradicate hepatitis C from the body.
So for hepatitis A and B, okay, let's talk about some types of prevention. There are vaccines for both?
Yes, there are vaccines for both hepatitis A and B, but hepatitis C, there's no vaccine. No vaccine, but there is a cure.
Exactly. So it's kind of like
so it's okay.
That's what the person that I was talking to a long time ago said. He can cure his hepatitis C, but for A and B, there's no cure. I mean, you treat it, and then for hepatitis A, it seems to be the least vicious in a way. I don't know if it's proper. You have
hepatitis A is self-limiting, so it will go away by itself.
Okay, and then
maybe around 95% of the time. 95. And then there's a small percentage where they can develop fulminant hepatitis, like a full-blown hepatitis where their liver they can have liver failure.
Okay. So it's not the least vicious. It depends on the situation. Okay.
Yes.
And then for hepatitis A, the vaccine, doctors, talk about the vaccines a bit in terms of like prevention. How exactly can you describe to us how you get the vaccine for hepatitis A? Like, does the person only go there once, or is it a series of vaccines for hepatitis A and hepatitis B also?
Yeah, usually the hepatitis vaccines have already been included in the expanded program of immunization of the government. So kids usually should be getting their hepatitis shots, no, especially hepatitis B, no, because that's really the more important type of hepatitis, no, that can cause complications in the future, no, liver complications. So usually the vaccines are given in series, no. The adult hepatitis A vaccines are usually given in 2 doses, no, 6 months apart. Okay. And then the hepatitis B vaccines are usually given also in series, no. They have usually given 3 vaccines, no. The first, the primary dose will be given 2 months apart, no, and then a booster dose after 6 months.
Okay, so do you find, doctor, that when you vaccinate people, or when people get vaccinated that you know of, they don't come back for the other? Does that happen? Does that still happen a lot? Like, they'll take the first dose, but they won't come for the second dose with Hepa A, or they'll come for the first 2 doses for Hepa B, and then just not return.
Maybe 1 to 2 out of 10 patients would actually forget they were supposed to get another shot. No, but a lot of a great majority are compliant, but we still get those types of patients, and you do lose the opportunity. No, we lose the opportunity. The only remedy to that is just to repeat the whole process again.
Yeah. So if you like miss out on the last vaccine or the other two, you have to start all over again. Yeah, I wanted to bring that up because there, a long time ago, people were just like, I already got one. I think that's enough. But it's not, I already got one injection. I don't want to go back for the other. Or yeah, they would forget because it's like months apart. And you were saying, okay, so is that a public health measure? Are there other public health measures for, for the prevention of hepatitis? You mentioned that the government has already gone on, I guess, a campaign or, a type of, they have programs where they vaccinate children. So there are children who get vaccinated. You can get vaccinated for Hep B when you're a kid.
Yes, that's one of the 7 main programs of the government is to give the birth dose, no, the hepatitis B birth dose within 24 hours of birth, no, to give the first hepatitis B shot, no, within 24 hours, and that is actually protective, no, that protects the infant from acquiring hepatitis B from an infected mother.
Okay. Yeah, and that so within 24 hours they get the first dose. So
they should get the first dose.
Should get the first dose. Okay. And this is this like are hospitals, whether public or private, or let's say lie-in clinics, would you know if they're aware of this and they actually do it? Like they include it in is it already like standard included in the vaccines that a child should get or a newborn should get?
Yes, these are policies that are mandated by the government. So all hospitals, clinics, whether it be a tertiary clinic or a lying-in clinic, should be able to give these hepatitis B vaccines, no, to the infants, no. And mothers should also demand this, no, that the vaccines, no, should be given at birth, no, and to prevent these very common and preventable diseases.
And I guess these days it's easier to follow up with the vaccines of a kid, no, or an infant, or someone who's, because they have a schedule for vaccines. And I think a lot of people, most people really like bring their children after birth to get the vaccines, and then throughout the the growing years up to the time when they're like teenagers and 18. But I guess before, would you know when this started, doctor? Or it's okay if it just seems like it's good that the government has mandated this. There are a lot of people I know who don't, who didn't get vaccinated when they were kids. Maybe older people like me.
Well, as far as I recall back, the expanded program of immunization started sometime in the 80s, in the 1980s. No, so usually it's probably been around for almost 40 years. No, so but of course, just like with any program, no, there are a lot of challenges, no.
Yes.
And which inhibit, no, from us reaching our goals, no, because these particular programs are geared towards goals, no.
Yes.
For example, the Philippines was part of the Millennium Goals, no, which seek to eliminate viral hepatitis, no, by 2020, no, in the country, but we haven't really achieved that yet.
But we're getting there, doctor. I mean, do you think that people, it's something with patients who are not aware, or people who are not aware, or is it also a systemic thing? I mean, there's also people who give birth at home still, so I mean, in the because of the way our socioeconomic structure is, not everyone is able to have access to, better healthcare. And even if there are clinics in certain areas, I've seen it myself. There's things that are lacking. Sometimes they don't have medicine, or it's just remote areas. Is that part of the challenge that you face in like not being?
Yeah, in terms of public health, no, maternal and child health, no, is actually also one of the main priorities of the government, no, and ensuring adequate maternal and infant care sometimes can still be lacking, no, and hepatitis B, since there should be more awareness, no, so year in year out, no, us doctors and different societies, different medical societies, like what I am also part of, which is the Hepatology Society of the Philippines, no, we advocate viral hepatitis awareness, so that people are also aware, so that they themselves can voluntarily get tested, and if they do need treatment, to also seek treatment. And because hepatitis B can be just passed on from one generation to the other, no?
It's the act of giving birth, like going through the birth.
Yes.
Okay.
Yes. So an infant, no, going through the birth canal, getting exposed to the body fluids of the mother, no, getting exposed to the blood of the mother, no. That's how a baby would contract the hepatitis B. No, if
it's cesarean.
Sorry.
What if it's a cesarean?
Even then, no, because they have to go through, the be exposed to the blood, no, of the mother, no, through cesarean section, as well as her other bloody fluids.
Thank you, doctor. I'm asking you some questions that some smart asses might ask, like, well, I'm getting a cesarean. Like I have to be that person during this discussion, because so many questions can arise and so many scenarios. Because I notice people tend to avoid vaccines, like me. I mean, it's a certain generation. It's natural. You freak out. It's a needle. It's something put in your body, and I'm just so happy that we can stress the importance of vaccines and their availability, not only to adults but to children. Okay, thank you, doctor, for giving us all that information. And if you'd like to talk about it more later, like your advocacy, we can do that too. Okay, so back to the discussion of Hepa B and Hepa C. Okay, so Hepa A, sorry, I'm like shortcutting it. Hepa A, like they're my friends, Hepa A, no, I don't want to be friends with you. Hepa A, you can get a vaccine but you treat it, no? And then Hepa B, you can get a vaccine, which is probably the best thing to do so you don't get it. And you can treat it. Hepa C, there's no vaccine, but it's curable. You said there are medicines that act really well, in terms of curing or treating whatever the virus brings to the body and how it affects the body. Now, doctor, okay, so the vaccines, I know it's a thing with us in our society. We don't want to go back for the booster. I'm like that too. So just a reminder, if you do, I hope, this show encourages people to go out and get checked for hepatitis if you have the symptoms, and to, get the vaccine. And I'm gonna have to tell myself that too, because I am not vaccinated, doctor. Okay. Are there other steps, like, can you tell us, doctor, how do you treat hepatitis A? Like, what's usually the treatment? Someone will come to you or go to their primary care and say, my right side hurts. And then, you suspect that they have hepatitis. How do you treat that hepatitis A
Yeah. It's supportive, no? The medications are all supportive in nature. No, there's no medication specific for hepatitis A, So we try to support, the patient, For example, we can give hydration, medications for the fever, and all of those other supportive measures, Because since it's a virus, and it's a type of a self-limiting virus, no, so it should eventually go away, no, just like a flu, no, you don't really have to do anything to it, no, you don't have to take any antiviral medications, no, but it will just go away.
Like as you said, comparing it to the flu, there are people, and myself included, who have landed in the hospital from having a bad flu, a case of bad flu. So if basically supportive medicines are like if you give medicine for fever, if the patient has fever, and if they're feeling pain somewhere, you could probably deal with
You
that.
give pain medications.
Patients and I guess the IV, would be you put them in the IV when you admit them, and the
You give hydration.
yeah.
Yes.
Okay, so that's how you do it, and then you said it's self-limiting. Once you help the body kind of get over it, and then after that, the patient is good, and you get the patients who have hepatitis A get immunity from
Yes. And it's also important to do the monitoring, no? While they're admitted, no? You regularly monitor their liver function, no? Because as I've mentioned, although it's not very common, no, there's a small subset of patients that may develop fulminant hepatitis, no,
Yes.
or very severe liver failure.
So doctor, when you check the liver function, this is done through a blood test. Yes.
Yes.
Do you have to fast for it? No.
The blood tests for the liver do not actually require any fasting.
Okay. So there, less to worry about for patients who freak out about fasting. So well, let's say they're under your care already, and let's say they're admitted in the hospital. You do take their blood from time to time to check the amylase, the SGPT, and all the other things that. What do these tests tell you about the liver? Like, or is it? Okay.
So it tells us if there is severe liver damage, no, or severe liver destruction, no. Your SGPT or your ALT would tell you that, no? And bilirubin, which measures the amount of yellowness.
Okay.
So somebody who would be severely jaundiced or very yellow would have very, very high bilirubin levels, no? So
there you can
actually, we can actually get a trend, no, towards improvement or decline, no, of liver function.
Doctor, best case scenario for someone who comes in with hepatitis A, how do they feel? Like how do you treat it? Like maybe within how many days are they okay already?
On the average, patients would probably stay around 3 to 4 days, no, as we monitor their liver function, no, and usually by that time they should start feeling better, and we usually can discharge them, no, when we actually see a trend towards improvement.
And then, doctor, okay, so you did mention like they could get severe liver damage function. Can you talk about the worst case scenario, especially if, let's say, a patient does not say, I'm okay this way, I just know it's Hepa A, it'll go away. If it's left untreated, what's the worst case scenario for Hepa?
The worst case scenario is probably fulminant hepatic failure, no? Wherein essentially the liver gets shot, no? And with that, no, the only option is really to do a liver transplant, no, to replace the liver with from a donor.
So we should not take these things lightly.
Yes.
Like, we should not say, oh, it's just Hepa A, I can get over it, or because if you leave it untreated, your liver could just fail, and then you'll need a transplant, and that would be the cure for it. When you transplant a liver, doctor, by the way, do you take only part of someone's liver from a live donor?
There are many ways to transplant the liver, no? You can have a living donor transplant or a deceased liver transplant, no? Usually for a living donor transplant, no, we get a portion of a live person's liver, that is the one that's donated to the recipient.
Okay.
No? For deceased donors, no, we can still get a part of the liver, no, and use parts of that liver to be donated to multiple one or two recipients.
And doctor, okay, so true or false, does the liver grow?
Yes, the liver grows, no, but only to a certain extent, no. It may regenerate, no, and grow, but not like a lizard's tail, no.
Yes,
So,
yes, you don't chop it off, then it goes back. Yeah,
yeah.
It sort of how does it happen? Like only parts of it regenerate and they kind of start working together to how what about
So the liver cells multiply and it increases in size, no? That's how the liver regenerates. And but the capacity of the liver to regenerate is of obviously not 100%, no.
Yeah.
So it's only to a certain degree, no. And as long as the insult, no, the injury is halted, no, that's when the liver is able to have its process back of healing itself.
So for the folks out there, when in medical terms, when you say insult, it's like it's the, as a doctor said, it's the injury. Like think of something like slamming into it and hurting it.
Like for example, viral hepatitis, no,
Yeah.
that's the one that's causing the insult, no. Alcohol, no, alcohol intake, no, it's causing an insult to the liver, no, or the injury, as you have mentioned.
Thank you, doctor. Okay, so at least the people who get hepatitis A or who who are thinking about getting the vaccine, it's not something to take lightly, because that is the worst case scenario. Okay, and then how about hepatitis B? What happens if you leave it untreated?
Hepatitis B, no, when you leave it untreated, no, through the course of a person who has chronic hepatitis B, they have a 20% chance of developing liver complications, no, such as development of liver fibrosis and liver cirrhosis, which is excessive scarring of the liver. And from that, no, since hepatitis B is also considered a carcinogen, no, it's a cancer-causing virus, no. So a person who has hepatitis B has a higher chance of developing liver cancer compared to a normal individual who does not have an infection.
Okay, so with hepatitis B, when you say fibrosis, that's the scarring.
Yes, fibrosis is actually the intermediate. No, fibrosis is actually the intermediate stage. No, between a normal liver and liver cirrhosis. No, the liver cirrhosis would be end stage. No, liver destruction, where the liver is practically almost replaced by very fibrotic and scarred tissue. Liver fibrosis would be like a lesser degree.
Okay.
And we do have measures to measure the degree of liver fibrosis, and we have that particular machine. We have at Makati Medical Center as well.
Great. Okay. So you have a machine in Makati Med that can measure the degree of fibrosis or cirrhosis, no? And when you say cirrhosis, is that what people call cancer of the liver?
No, that's actually it's very common misconception. Right? I get asked that all the time. No, is liver cirrhosis liver cancer? No, they're two different things. Liver cirrhosis is when normal liver tissue is replaced by scarred tissue. No, you know that scarred tissue is actually almost non-functional.
Yeah.
You know, when you have a scar on your arm or on your leg, the sensation is less.
Yes.
The elasticity is weaker. No, it's more gummy. No,
Yes.
it has poor elasticity. No, it's not like normal skin. No,
Yes.
you can put probably the same metaphor or the same analogy to how the liver is when it's scarred. So essentially, the function of the liver globally, no, is decreased, no. And when we say scarring of the liver, it can happen all over the liver, no. Different parts of the liver, it's interspersed. No, it's not like only one part of the liver has scarring and is cirrhotic, no. But usually, liver fibrosis and liver cirrhosis is usually global. No, it affects the entire liver. No, and it really varies on the degrees.
Like it's as you said, it's important also to note, because in our imagination as patients or as people who are not very familiar with liver fibrosis or cirrhosis, we think it's only one area, right? Our minds go already, but as you said, it could be like the top, the bottom, the side, inside, somewhere else. So it really affects how the liver. You have these like sort of dead skin type, if that's the metaphor, that they don't work, and that will lead your fail.
In liver cancer, no, just to answer your question, liver cancer is a growth, no, that can happen from liver cirrhosis. So when a person has liver cirrhosis, their risk of developing liver cancer actually increases also. So a cirrhotic liver is a fertile ground, no, for developing neoplastic growth or cancers. So those who have liver cirrhosis should be actively screened, no, for liver cancer, because at any point in their life, no, they may develop a tumor.
Okay.
But persons who have hepatitis B, no, they don't need to have liver cirrhosis to develop a tumor. They can actually skip that part, no. They can go from normal liver or just mild fibrosis to liver cancer and skip over liver cirrhosis.
So if you leave it untreated, that can happen. So it's not something to take lightly either. And how do you treat someone who has hepatitis B?
Okay. As I've mentioned, there's really no drug in the market right now that can eradicate or eliminate hepatitis B from the body, no. But we have what we call antiviral medications, no. So antiviral medications that can actually suppress the activity of the virus, no. So if you have less of the virus and less of the activity, you have less insult and less injury to the liver, less inflammation and less chance of developing fibrosis and less chance of developing liver cirrhosis. So and also less chance of mutation of your cells, not to liver cancer.
Okay, so doctor, like as you said earlier, it's comparable to having HIV or AIDS.
Yes, similar, very similar.
Very similar. So like right now, in terms of HIV and AIDS, there's no cure, but there's you can treat it with medication, slow it down, suppress it, as you said. That's the key to it. Suppress the hepatitis B virus, and so that it doesn't turn into cirrhosis, or suddenly skip that part from mild fibrosis and it becomes a cancerous liver. And we're talking about cirrhosis of the liver, doctor. This is a term that really was thrown around a lot throughout my whole life because of people who drink. Can you tell us about it? Like what? I mean, you explained that we contract hepatitis B through body fluids, but why is cirrhosis of the liver associated so much with people who drink a lot?
Okay, so liver cirrhosis is actually a complication, no, of different types of injury or insult to the liver, no. So a while back we did talk about viral hepatitis, no,
yes,
being a causative factor of liver insult and liver injury that can lead to liver cirrhosis, no. But it's the development of liver cirrhosis is not exclusive to the etiology of viral hepatitis alone. We also have other causes. No, for example, as you mentioned, alcohol. No, chronic and excessive intake of alcohol does induce liver damage, no? And over time, no, an alcoholic, no, can end up with liver cirrhosis, no? For those who do not have viral hepatitis, do not drink alcohol, but still get liver cancer or liver cirrhosis, no? What is also a rising phenomenon or rising epidemic is fatty liver, no? Fatty liver and metabolic diseases, no, such as diabetes, hypertension, obesity, dyslipidemia.
Okay.
These factors drive the development of fatty liver, and that is another etiology for developing liver fibrosis and liver cirrhosis.
Okay. So, doctor, would you say that people can do something to kind of, aside from getting the vaccines for hepatitis A and B, we're still on hepa A and B. Like, they're my friends, like, hepa, come here. Don't come here. No, sorry, don't come here. Go far, far away. Would you say that, because we've talked about drinking and fatty liver, are there things that people can do to keep their liver healthier? I mean, if their liver is healthier, is it less susceptible to damage from hepatitis A and B or even C? If they're,
the liver can actually take care of itself. No, you actually don't have to take a lot of things, no, to keep it in shape, no, because it's like your independent middle child, that can take care of itself.
middle child, no, that's okay. You don't have to answer that. I know what you mean, though. Middle child, they're very independent. They get things done. They don't have to get too much attention to. I'm not a middle child. I'm the bunso. So yeah, but I know what you mean. I acknowledge that, and I respect the middle child. Yes.
Yeah. Well, no offense to middle children out there, but they do. The liver does not have. The liver does not need a lot of maintenance. No, it can take care of itself. No. The only thing that it requires of us is that we do not dump, toxins on it. No. For example, like alcohol. Unknown medications, no, unknown supplements, unknown herbal.
Yeah, that's the thing, doctor. No, everyone's
all of
into
those things.
herbal supplementing, but are you? I think you should check with your doctor because there's so much of it. Like there's this for that,
Yes. Herbals may have a role per se in helping out, bodily functions, no. But sometimes, no, we have to check what is in those things that we take in our body, no. That may be the ones that are affecting, our liver function. So we have to be careful, no. We have to be vigilant, no, and not take everything, no.
It's there on the market, thinking it will
Just what's there, no. So you have to be very discerning, no. And that is actually what we want to advocate, no, to our patients, no, to be responsible, no, and not just take all of these things without question or without being attentive, no.
Yes, doctor. I'm glad that you and your group you're advocating that because I noticed that the prevalence of all sorts of supplements, and no offense to those who sell supplements or take them, but I've seen like it can be too much. I'm like, what's this for? And then this one's supposed to make your brain active. How? I'm like, what are the ingredients? It's just become such a thing, and people think that it will keep you like your immunity up, but there are so many things. Like I've had arguments with people who I feel they overdo it because I'm like, wow, man, that's quite a lot. You think you should just take real medicine. I mean, it is medicinal in a way, but I think you should check with your doctor. And so I'm so glad you're advocating that because all of these things we take, our liver processes it. So yeah.
Yes, correct. Yeah. So one of the first landing points is actually your liver, no, together with your kidneys. Yes. So we have to be careful of what we take in because they they may have a impact on these particular organs, no?
Yes. I mean, doctor, I know people who are like, they've been told, oh, just take, acetaminophen or paracetamol. Okay, I'm not naming brand names here, but just take it every day or whatever. But you see on the warning label, if you have pain for more than 7 days, check with your doctor. I mean, even those medicines, the over-the-counter medicines, can they do a lot of damage to the liver if it's overdone?
Yes. We can have actually acetaminophen or paracetamol induced liver injury, no? Which can be fatal as well.
Oh, people, I know what you do. I also know, doctor, when you're at a certain age and you're drinking a lot, and the next day you have a hangover. A lot of people, they imbibe so much alcohol, then I'll see them. They're like, oh, I'm going to take an acetaminophen now or a paracetamol now so that when I wake up, I don't have that headache. And I'm like, but you're not supposed to. Of course, I've also imbibed alcohol, but you're not supposed to. It really can cause liver failure if it's too much.
If you take in too much alcohol, acetaminophen, yes, if it can cause acute liver failure. You can have a drug-induced liver injury from paracetamol or acetaminophen, and that is actually medically documented.
Okay, how about non-steroidal anti-inflammatory drugs or NSAIDs?
NSAIDs can also cause liver injury as well, no? So you have to also be careful of taking excessive NSAIDs, no? Apart from the other things that it can cause, no? So that's something that us gastroenterologists are also concerned about, because it can cause gastric ulcers and
Doctor,
bleeding.
sorry, it seemed like I went off topic a bit, but what I'm trying to stress is like how we have to also like manage liver health in terms of other ways, so that if you're unfortunate enough to contract something like the hepatitis virus, then all these things that you do, or without even knowing all these things that you take, you should be aware of it in order to take better care of your liver. So, doctor, I'm going to ask you about hepatitis C and really get into it. Thank you for your patience. We just need to take a short break. Would that be okay with you? Okay.
Of course.
So, folks, stay tuned. We're gonna finally go into Hep C, and then doctor will give us so much more information. He's a great guest, and as the person said, Pogi. It's true, doctor. Own it. Okay, so we're just going to take a short break. We'll be right back. Stay tuned to Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
This is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗲𝗃 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝗁𝗵𝗹𝗆. Available for outpatient care services, our 𝗛𝗶𝗁𝗵𝗹 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗛𝗶𝗁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗛𝗶𝗁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗛𝗶𝗁𝗵𝗹.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Oops. Hi, everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We're here with Dr. 𝗛𝗲𝗹𝗆. He is a gastroenterologist and also a hepatology specialist. So that means he can treat your stomach and your liver and your whole abdomen. And, doctor, people ask me for recommendations, and I also ask other doctors for recommendations. Would you mind if I recommended you to some people I know who need to get checked?
Oh, thank you.
Yeah,
Of course.
it's the gastric. I actually think that a doctor in Makati Med mentioned you to me, said this young guy, and then I think I remember like it's just ringing a bell now. So you're one of those. Of course there are other gastroenterologists who have taken care of us over the years, but there are like 8 of us in line, so maybe we should split it. If you don't mind, after the show, if I can get your contact details, that way I could steer the people towards your way. Okay, doctor. So let's get down to hepatitis C, because it's like it's sort of counterintuitive that there's no vaccine but there's a cure. So can you tell us more about hepatitis C?
So So hepatitis C is also it's a different kind of virus. No? It's an RNA virus. No?
Okay.
So unlike hepatitis B, which is a DNA virus, no. The difference is that the hepatitis B, the virus itself integrates itself into the host's DNA, so it escapes eradication. No, that's why it's very difficult to treat. No, because it hides.
Hepatitis B
inside. Hepatitis B hides inside your
liver,
your liver, the cells of your liver. No, inside the DNA. No, of your liver cells.
Wow.
So that's why it's very difficult to eradicate. No? Hepatitis C, on the other hand, is a RNA virus. No, so it does not its own it does not integrate itself into the host's genetic material. So in a way, it's a bit more out there.
Yes.
So it can be eradicated by drugs, no? And these drugs have already been out in the market over the last 5 years, no? So we can actually cure hepatitis C.
Okay, that's great news, doctor, especially for people who have hepatitis C. And can I ask you, when you say the DNA and the RNA, is that sort of like what everyone discussed when it came to the vaccine for COVID? Like the RNA, is that where does the Hep C sort of, it's not embedded in the liver, but it kind of tells itself to replicate? Is something like that? No, absolutely not.
Well, there's a lot of cell biology involved there,
Okay.
which might be difficult to process for
Wait, you
your
cannot teach
audience.
me right now. Thank you, doctor. Okay. I just ask questions as they come because I'm the type of person like when I have this conversation with you, I really hope you don't mind. It's like me walking into your office and asking about all the possibilities, and there are questions that we get that are similar to the way my brain just shoots off and asks anything. But thank you for being such a good sport and for answering all the questions. Okay, so as you said, hepatitis C doesn't embed itself in the DNA of the liver cell. So it is in the last 5 years, you have medicine that can treat that. And will it fully eradicate hepatitis C? The
From the
medicine
liver.
liver?
Yes. No, they're so effective. They're like the efficacy rate of these new drugs is around reaches up to 98%. No?
Oh, okay.
So those who get treatment actually get cured.
Are they oral?
But
Oh, go
but
ahead.
the caveat there is that you can be reinfected again.
Okay, yes. Okay, so you get cured, but you can be reinfected, and there's no vaccine.
And
So
there's no vaccine for it.
let's say you have hepatitis C, you get cured. There's no vaccine for it, but you can get reinfected by doing the same activities. I mean, like let's say having.
Now, for example, if you're exposed to the similar risk factors, no, for example, like hemodialysis patients, no,
Okay, yes.
they get dialysis every week, no,
Mhm.
they're exposed to a machine, no,
Mm.
that is exposed to the blood of another person, no, they may contract hepatitis C more than once, no, especially if there are if the practices of
Yeah.
separation are not strict.
Do you advocate for that as well, doctor, to make it a better and safer environment for patients who get hemodialysis? Because I mean, I know in our country there are so many, no, who need.
Yeah, definitely.
Yeah.
Definitely, no, definitely. That's why we try to adhere, no, to very very strict standards, no, in terms of healthcare delivery, because if you do not have very strict standards, no, you end up causing harm that you might not even know that you're already causing, no. So we have to be very very careful, no, with these things, no.
Yes, doctor. I mean, from the past few years, I worked somewhere and I had the opportunity to learn about like, where they need help, how many patients need this, what kind of diseases or illnesses are becoming very prevalent. And a lot of people need hemodialysis, and there are all sorts of centers popping up. And so I'm like, really? That's a place where, where you get dialysis. And I really want to thank you for bringing that up and for you and your group to advocate that, because I came across one case where they weren't using distilled water or something, or they just from one patient to another, shook straight there. Like it was really not, they were just making money, because okay, I'll take you in, but they would use the same. I mean, they wouldn't clean it or follow the protocol where you need a new set of this, you need a new set of that.
Yeah.
And I really don't know
So-
where the water comes in, but I know for patients with kidney illnesses, distilled water is better than mineral water. So, I mean, there was just this whole thing about it, and I could not believe it, but people do that. So I'm so happy and thankful to you and your group for advocating for that.
No, there's actually a dedicated machine for those who have hepatitis B as well as hepatitis C. No, so there are dedicated hemodialysis machines, no, so that they don't get mixed, no, with the general hemodialysis patients.
Okay, thank you, doctor, for letting us know. That's so important, because someone who might seek treatment or someone who is seeking treatment or knows like their family member, that's something that I hope we've alerted them to during the show. And also, doctor, before, maybe like 40 years ago, that is when we started. I think people would get maybe hepatitis B and C and other illnesses as well, including HIV, because a lot of places, maybe also because of the economic situation, they would reuse needles. And also people who, engage in drug use through needles, they would reuse it, and that's what can spread it. But also, like, as you said, blood transfusions, have there been, I know, like, before, probably it was not, they didn't really screen the blood well. Do you find now that there has been so much improvement in that sense?
Definitely, no, definitely the risk of bloodborne transfusion-related infections has actually been decreased, no, because of the very, very strict efforts of our blood banks, no, as well as the change in policies, no, on blood donation, no.
Okay, sometimes, of course, I've been in this scenario where we're in the hospital with family members, and then that's why you would hear all the time, no, 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 give her my blood. Because I think before, people were aware that it's not as strict as it should be, or no, give her my blood. But now you when you donate blood, you screen it really well. And, you don't have to insist on donating your own blood because, let's say you're B positive and then you need blood, you will give B positive blood even if it's not like your relatives, right? The plasma or whatever it is, whatever the person needs. Let's say for dengue, it's I forgot.
Platelets.
The platelets. Thank you, doctor. But it's not really exactly from that person. Then when that person, like, is not from the sister or the cousin or something. But do you still encounter that, like, a lot of people are like, no, 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 I want my blood in her or my blood in him. Do you still not really?
Not really. No, but usually,
yeah.
Most patients would just be happy to accept blood, no, that is available.
I remember once people talked to doctors. I was hospitalized, and doctors were talking about the blood transfusion, but I didn't get it, thankfully. But I had a friend there, and she was like, "I want to give you my blood," very, very generous. And I was like, "I don't think I want your blood." It was a joke. I was like, "If I get your blood, I'll be drunk." But that was a joke between us, and thank you for offering that. So, doctor, when it comes to hepatitis C, how exactly do you treat it?
Usually,
I'm sorry, with the medicines, are there any other things you do? Like, does the patient have to be?
Usually, the patient would have to do initial examinations, which involve like some blood tests, no, apart from the usual imaging or ultrasound, that we do. And once we do confirm that the patient has active viral hepatitis C infection, then we tailor fit the medication or the regimen that is for that patient. No, so usually with the advent of the new drugs now, no, it used to be like an injectable that's given every month for a year, no, and they can become very toxic. No, they can have complications. No, you have to do monitoring, check the CBC and all of those things. No, regularly. No, but now it's just a very short course. No, sometimes just a 3-month treatment. No, with oral medications. No, nothing else, and it's 98% effective. No.
What you were saying earlier about injectables, I mean, it's so great that now it's usually a 3-month course. And I remember the person I knew with hepatitis C had injectable medicine for his liver, and he would travel with it and keep it in the refrigerator. Would that be the one that you're referring to from before, from years?
I'm not sure. No, it
Like
could be
maybe he had
anything.
something else.
Could
You're
be
like,
insulin.
yeah. No, he wasn't diabetic. So you're like, that doesn't sound right. Maybe he had something else. Okay, thank you, doctor. I was just wondering, these injectables now, do they have to be like, is it hard to maintain? I mean, does a person have to like make sure it's all, sometimes when you have injectables, it feels like, it has to be frozen all the time. And what if you can't go to the doctor at this point? Do they give it to you? All of that plays into it. Is it much easier now and like lower maintenance to keep the medicines?
Now we don't use injectables anymore. No,
Okay.
the advent of giving injectable medications for hepatitis C is almost non-existent. No, because we have shifted to a easier form, which is the oral tablets. No, that the patient just takes once a day.
Okay, that's great, doctor. So you're like, maybe he wasn't treating his liver. Maybe he wasn't. Maybe he had something else. Okay. Yeah, it does sound like diabetes, doesn't it? Like the insulin. It sounds like that. Okay. So doctor, when it comes to all sorts of viral hepatitis, A, B, and C, hopefully there will be no more D, E, F, G, H, I, what?
There's actually hepatitis D and hepatitis E.
Okay,
So,
what?
but these are not very common viruses, no. So they're not very clinically significant in the setting of the Philippines.
Okay. Doctor, for you, and in your practice, what you've seen, what is the most, which strain of the viral hepatitis A, B, or C is giving the population the most problems right now?
Well, what is causing very extreme public health burden is actually hepatitis B.
B, okay.
Because hepatitis B leads to development of liver-related complications.
Now, what are the complications? Can you?
So yeah, you have that liver cirrhosis, liver fibrosis, liver cancer, no, which are complications that can cause morbidity, no, to a person's life. No?
Doctor?
So hepatitis B, no, I'm actually very strong advocate of hepatitis B awareness.
Doctor, can a patient or a person get, an adult, let's say we didn't get the vaccine from a long time ago, can they get vaccines now for hepatitis A, B, and C? I mean,
yes, you can get yourself vaccinated for hepatitis A and B. What we do is that we check your titers first, no, and then check if you still have active titers, no, if you still have antibodies, no. So if you have antibodies to the hepatitis A and the hepatitis B virus, then you do not need to be vaccinated, no, as long as you have sufficient numbers.
Okay, I see. Because what if you contracted it before and you didn't even know, right? Or
there are some, no, because Philippines is also endemic to hepatitis A. No, we have a lot of hepatitis A in the country. Some may actually contract hepatitis A without knowing it and develop immunity against it.
And doctor, it's really also the food preparation, and we eat everywhere, and you can't. We eat everywhere. We eat fast food, any kind of food, and not to put down people who serve food, but really, how can we all, aside from getting vaccinated, what tips would you give us to avoid getting hepatitis A, B, and C, like preventative tips aside from the vaccinations?
So aside from vaccinations, no, with regards to hepatitis A, make sure that you try as much as possible to eat in reputable places. No, make sure hygiene and sanitation are intact. No, so those are some of the means. No, hepatitis B and C is of course to avoid risky behavior. No. Engaging with multiple sexual partners, no. Also, getting yourself tested, no, periodically, no, especially if you are at greater risk.
Yes.
No, there are certain populations that are at greater risk. No, healthcare workers are at higher risk of developing, contracting viral hepatitis B and C. No, just because of their line of work. Those who undergo regular hemodialysis, commercial sex workers, no, should also be screened as well. No.
Getting the screening for STDs or sexually transmitted diseases, get screening also for hepatitis A, B.
Yes, it's usually part of the screening, no, together with all of the other sexually transmitted diseases. No, and yeah, that's how to prevent it. No, try to avoid sharing needles, razors, toothbrushes. No, nail cleaning equipment. No, nippers, nail cutters. No, ganyan. So all of those things are.
I mean, it's so important because most of us wouldn't think of the nail equipment. You know.
Yes. You can.
I mean,
even the blade, no, razors, no. When you go to like a barber shop, no, for guys, no. When you get yourself your hair cut, no, just avoid, or your beard or your mustache, no, taken care of, no. You should use always a new set of cutting equipment.
Doctor, do you find that there's a stigma when it comes to hepatitis B and C?
Definitely. There's a stigma against hepatitis B. No, hepatitis C maybe not as much because it's not that prevalent. No, there's not a lot of people with hepatitis C, but with hepatitis B there is a lot of stigma because there's a lot of misconception in terms of how it can be passed on. No, so. Hepatitis B is not passed on through holding hands, kissing, preparing food. No, you don't get it with casual contact. No, like talking to another person or sitting next to another person. No, so you can employ. No, we can employ people who have hepatitis B. Because the transmission, no, is, we have to understand how it's transmitted, and you can't just transmit it that way, no.
Yeah.
So even if they're handling your food, no, it's okay, no, even if they have hepatitis B.
Thank you, doctor, for that, because that's so important to, for people to hear. And do you have any final words or any advice for people, like, if they think they have hepatitis A, B, or C, what should they do? Or is there anything else you'd like to say, or anything you'd like to advocate for when it comes to this topic, or anything else actually?
Okay, so first and foremost, I'd like to thank you, Nicole, for a very extensive interview, no, about viral hepatitis. No, you did ask some of the very great questions tonight. Well, first and foremost,
you're okay with it. We're okay. Okay, thank you, doctor.
If you do have, if any of your viewers would have any questions or any queries with regards to knowing about viral hepatitis and liver health, no, we have a range of gastroenterologists as well as hepatologists at the Makati Medical Center who can help you with your liver concerns. And then number two, being an officer and vice president of the Hepatology Society of the Philippines, no, we would also like to advocate liver health. No, coincidentally, January is Liver Cancer and Viral Hepatitis Awareness and Prevention Month. No, so that is actually mandated by the government, no, under Republic Act 105/26, no, that every January is celebrated, no, for this specific reason, no, to raise awareness against viral hepatitis and liver cancer, no. So it's that important to the Filipino people, no. So
thank you for executing the law.
Yeah.
Thank you,
yeah.
Doc. A lot of people, the laws are there, but they don't do it. Thank you for doing that today
Yeah.
for us, for all of us, for the whole audience. Anything
All
else?
right.
Higher by to anyone?
That would be all. And as we would always say, to be aware, you should be tested, seek treatment, be treated, no, and try to get the help that you need, no, from the doctors, no, your gastroenterologist, your hepatologist, not just here in Makati Med, but all around the whole Philippines, no. There are a wide range of competent gastroenterologists and hepatologists throughout the country.
Thank you, doctor. Thank you for joining us on the show. Thank you for being so patient with my questions and answering all of them and giving us really a great, thorough picture of hepatitis A, B, and C, and just for giving like us the best advice. I'd also like to thank the team who brought you on the show, and thank you for advocating for all of this. It's important for all of us. Thank you, folks, for joining us. They were out of time, so I'll see you next week. Doctor, thank you. I hope this isn't the last time I get to interview you or see you. Take care, everybody. Bye, Doc.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.